Hi, my name is Kristen and I'm a registered physiotherapist. Welcome to this foam rolling movement practice. This practice was designed to release muscular stiffness and rehydrate the connective tissue and fascia. You'll want to choose a soft foam roll, something that is firm but has a little bit of bend or give when you put any pressure against it. The softer foam roll is much better at getting into some of the muscle tissues to work into the fibers without activating a painful response and to help the fluid flow of the lymphatic system. You can do your foam rolling against bare skin or against snug fitting clothing. Nothing loose to get caught up on the roll. We'll be doing from the bottom half, working all the way up to our neck today. As always, move at your own pace, use your best judgment, and take breaks when you need to. So starting on lying, sitting on your mat, starting with our calves. If you place your calf on the roll, you're going to turn the foot in, and just with the knee bent, you can straighten the knee, turn the toe up, and roll it back. Starting just a little bit of rolling in and around the calf. It's nice if you can kind of create this circular movement with turning the foot in and out. And if you have a little bit of strength in your arms, you can actually move your whole body to do this. So sliding down all the way to your knee and then sliding back to the ankle. Rolling up to the inside and down the back side. You want to do about 5 or 6 passes. One more time for me. Then we'll move the roll up towards the back of the thigh. Same idea. If you're able to use your arms to slide, turn the toes inward, slide down towards the back of the hip, turn the toes upward and slide back towards the knee. We're not crossing the knee or the hip, but we're trying to get as much passing, cover as much area as we pass. Turn the toes in, roll towards the hip, turn the toes up and roll back towards the knee. So try that 5 or 6 times. Making sure you're breathing nice and calmly. I like to breathe in and then breathe out as I come back. In and out. One more time for me. Good job. We'll do that on the other side. I'm just going to turn to face the camera. Again, place your calf on the roll. Turn the toes inward slightly. You can bend and straighten your leg and roll back. Or you can use your hands to cover a little bit more area, sliding down towards the knee and then back up. Breathing in and out. You might find that you need to adjust your roll, that it travels with you, and that's okay. Good job. One more time for me. Going towards the back of the thigh, the hamstring, placing it above your knee, having your other knee bent to kind of get out of the way and help you maneuver. Turn your toes in, just push your body. You don't have to lift your body very much, just sliding yourself along the mat. Make sure you're not crossing the knee, adjust the roll as you need to. Breathing in and out. Turn your toes in and turn your toes up. So some circular passing movements along the back of the hamstring. One more time for me. Okay, good job. So we've done our calves, our hamstrings. Now we're going to do the inner thigh. If you roll over onto your side, place your roll so that letting your leg rest on the roll just above the knee and angling the roll so that it's about perpendicular towards the inner thigh. If you're propped up on your elbow, you can simply just roll yourself towards your tummy, letting yourself rest on your other elbow and then letting yourself push back towards the side. Making sure you're trying to stay relaxed through that leg. Let it be heavy against the roll. And push back towards the side. Take a breath in. And out. Keeping this knee very straight. Good job. One more time for me. Now that got the space that was more the inner thigh closer to the knee. To get the space that is at the inner thigh closer towards the hip, you can let your leg rest on top of it. Come onto your elbows and then wiggle back and forth. Again, the roll is perpendicular towards that upper inner thigh, and you're wiggling back and forth over that any sensitive areas there. Nice and slow, and stop if you need to, rest, and you don't have to go into anything that's too painful. Good job. Going on to the other side for the inner thigh. So lying on your side, let the top leg rest on the roll, just above the knee. Angle the roll so that it's perpendicular. It's 90-degree angle towards your leg. Resting on your elbow, and then you can turn yourself towards your stomach so that roll comes up the inner thigh. If you find it's hard to be on your elbows, you could lie on your side and just turn your body if that felt more comfortable for you. Letting your body fall onto the hand in front and then pushing yourself back. Breathing in and out. One more time for me. Moving into the upper inner thigh, you can let your leg come up a little higher, maybe adjusting the angle of the roll so that it's, again, that 90-degree angle. I'm resting on my elbows, and I'm just sliding back and forth, wiggling back and forth, getting that roll moving along my upper inner thigh. Breathing nice and slow. Try not to rush this. It's tempting to just rush it and get it over with if it's uncomfortable, but trying to go slow here. Breathing in and out. Good job. One more time for me. And then coming off the roll. We've done the back of the legs, the calves, the hamstrings. Now we'll do the inner thighs, and now we'll do the outer hip. If you come to sitting on your roll, you'll turn yourself slightly towards the side, straighten that leg, and then just let yourself go up and down that back pocket. If you're able to create any kind of circling with leaning a little bit forward and leaning a little bit back, that's ideal as you start to roll around there. Again, 5 or 6 passes, nice and slow with breathing. Good job. Going into the outer side of the hip, you can come down onto your elbow, maybe adjust your hip so that you get the space that's just between the crest of the hip and between the bony part, that greater trochanter on your outer hip, and moving with your leg and your arm up and down that spot. Breathing in and out. Okay, moving on to the front of the hip, the front pocket. If you let your top knee come up in front and fall to the floor, you're going to be getting into the front pocket of the thigh that is on the roll. So I'm trying to keep my left leg, my straight leg relaxed, and move through my arms, and my front leg, my right knee, is on the floor. Good job. Moving on towards the other side. Sitting on your roll, leaning towards the side, letting that leg go straight, and then starting to move back and forth, keeping this leg that's on the roll nice and heavy, trying to move through your knee that's bent and your arm that's resting on the floor. Breathing in and out, and if you're able to just lean slightly forward, slightly back, very, very slightly, just to create that circling movement, that's ideal. It may take a little bit of practice to find it. Good job. Moving on towards the side of the hip, you can come down onto your elbow, maybe making an adjustment so that you get the side of your hip between the greater trochanter and the crest of your hip, in that piece right onto the roll. Your bent knee here can be in front or behind you, wherever it lands that feels okay. Again, breathing in and out, moving slowly, going across those spaces. You can add a little bit of leaning forward, leaning back. Once you're comfortable coordinating here, get that circling movement, getting that lymphatic flow going as you work into those tissues. Okay, now moving into the front pocket, you can let that top knee fall forward. Make an adjustment with your roll if you need to. We're looking at this space that's kind of right in the front, where your quadriceps, your tensor fasciae lata muscle is. Keeping that leg on the roll, that nice and straight and relaxed as you move with your arms, either with your arms and your leg. Good job. When you're ready, you can come off of that. Now we're going to be going in towards the mid-back. You want to be rolling kind of all those muscular areas. We're not rolling in around the curve of the lower back. We're kind of rolling around that mid-back now. So finding the roll across the middle of the back, supporting your head in your hands. You can keep a little bit of a curve in your upper back as you start to move that roll up and down. You can see I'm just pushing a little bit with my legs. It's just enough to hover my hips so that they slide and move. You can work a few inches at a time, and then you might need to adjust the roll and work into the upper bit. But again, knees are bent, your eyes are on your knees, your hands are behind your head, really supporting the weight of your head. And you're keeping your upper back curved here. You're not letting your head fall back on the other side of the roll. Now we can get into the back of the shoulders a little bit. If you let yourself roll to your side, let your arms stretch out on the roll. And then let your arm come so that it supports your head. And you can roll with just doing some side bending through your kind of curling in and straightening out. Getting into the back side of the shoulder. And then getting into the underside of the shoulder, into around your lats. If you let your arm come above the roll, and then you still do some side bending, working this space kind of underneath the shoulder. If your head is feeling a bit heavy, you can kind of support your head with your other arm, working into your lats here. Breathing in and out. Okay, moving on towards the other side. We did our rolling for our upper back. We're on our back of the shoulder. So if you lie down, let your arm rest along the roll, and then letting your elbow dip below so that your head can be supported in your hand. And as you do some side bending, or kind of crunching inward, bringing your nose towards your knees, you'll be able to just cover a couple of inches with moving that roll a couple of inches across the back of the shoulder. Breathing in and out as you move, nice and slow. Okay, getting into the lats now, letting the arm come above the roll, letting that arm be heavy and relaxed. If you need some support for your head, you can always support your head with your upper arm. And then same idea, do some side bending where you bring your hips down and up. Now, if this is too difficult to maneuver your body, if the maneuver in your body is causing any difficulties elsewhere, then you don't have to do it this way. We're not trying to cause pain in one place to try to get a benefit in another place. We'll find a different way to do it. Good job. We've finished our back of our shoulder and our lats, and now we'll move on to the neck. You have your roll. You want to find it the base of the hairline. And from there, you can just move your head back and forth in a small little no. You can stay on one side and draw some circles. Trying that on both sides, drawing some little circles. Imagine you have Pinocchio's nose, and you're drawing some circles with that long pencil of a nose. Or you can do my favorite, which is the infinity sign, where you kind of do a figure 8 from side to side. Massaging that base of your skull area, those suboccipitals. And then just pause in the middle, take a moment. And then you can come off the roll. Now, it's always nice to check in to see how you feel before and after, maybe with a little bit of movement or maybe a little bit of a body scan, noticing your alignment. And then compare it to how you feel at the end of your practice, so that you can know if you should continue on with that practice or if it was painful, if you need to make any modifications. I hope you enjoyed this, and carry on.